Om Dham Dhanvantare Namaha. Karpuragauram Karunavataram Samsarasaram Bhujagendraharam Sada Vasantam Hridayaravinде Bhavam Bhavani Sahitam Namami. Let me share. So, topic is Ayurveda management of nephrotic syndrome patients. Actually, nephrotic syndrome is a renal disorder where the glomeruli are affected and there will be heavy proteinuria, albuminemia, and hypercholesteremia, and sometimes lipiduria. And also is associated with the general anasarca or whole body swelling. Renal disorders are on the rise in Indian population due to altered lifestyle, faulty food habits, long-standing metabolic and lifestyle disorders, and uses of nephrotoxic drugs like NSAID, that is non-steroidal anti-inflammatory drugs. The incidence of renal failures become common. Chronic kidney disease, nephrotic syndrome, renal calculus, urinary tract infection, benign prostatic hyperplasia, chronic pyelonephritis, diffuse glomerular nephritis, and acute renal failure. They are the few urinary disorders and the renal urinary disorders seen in general population. Nephrotic syndrome is a disease characterized by heavy proteinuria, hypercholesteremia, general anasarca, and lipiduria. When renal excretion of proteins exceeds 3.5 grams per 24 hours, it is considered as heavy proteinuria. Ayurveda management of nephrotic syndrome includes use of Vyadhipattanika drugs, protein supplementation, restriction of sodium and water intake, Pratyapatta Prayoga, diet therapy, and management of possible complications. However, some cases of nephrotic syndrome responded well to Ayurveda treatment. So this is a normal kidney. You can see in the 12 o'clock position there is glomerulus. There is tuft of capillaries inside and Bowman's capsule. And below you can see renal tubules. So here you can see renal tubules, the proximal renal tubule. So depending upon the depth of the kidney, the structure will be there, isn't it? So in the cortex, peripheral cortex, the glomeruli are seen. It has little below the kidneys there will be renal calculi, proximal coronary tubule and distal coronary tubule and calculi ducts are seen. You can see in this cross section is a kidney with the pelvic system and pituitary system. Here you can see the blood vessels also, RBCs are there inside the capillaries. So this is the histology of the kidney. You can see in the 7 o'clock position there is glomeruli. Glomerulus is there. So in 3 o'clock you can see the coronary tubules. So they are lined by cuboidal epithelium. The same kidney at different levels. You can see the tubules. You see the renal tubule, which is lined by cuboidal epithelium. These are some. The albumin test is done to detect proteinuria in nephrotic syndrome. Coming to introduction, Ayurveda medicine has a positive role in nephrotic syndrome patients. Nephrotic syndrome is commonly seen as a complication of disease like diabetes mellitus and systemic hypertension and chronic usage of nephrotoxic drugs. Hyperproteinuria, hypercholesteremia, general anosarca, and lipiduria are usually seen signs and symptoms of this disease. Nephrotic syndrome is caused due to damage or degenerative changes in glomeruli. Usually, glomerular basement membrane is damaged and there will be increased permeability in GBM for proteins. Hence, there will be heavy proteinuria in these patients. Because of protein loss due to proteinuria, hypoproteinemia results. Due to hypoproteinemia, there will be whole body swelling and bilateral pedal edema. Complications like left ventricular failure, pulmonary edema, ascites, and acute respiratory failure occur in this disease sometimes. Some patients of nephrotic syndrome end up in chronic kidney disease and finally death. Rapidly progressive glomerular nephritis, that is RPGN, membranoproliferative glomerular nephritis, that is MPGN, mesengoproliferative glomerular nephritis, idiopathic glomerular nephritis, IgG nephropathy, and minimal change disease or lipoid nephrosis are few types of pathologies which lead to nephrotic syndrome di- in, in diabetes, mellitus, and hypertension. Also, there will be degenerative changes in GBM leading to glomerulosclerosis. Ayurvedic medicines like diuretics, protein supplements, the cyanide drugs, nephroprotective, Ojaskara and Jivaniya drugs, Vayastamana, Poshaka, nutritive, immunomodulator, immunosuppressants, and hematinics are usually used in the management of nephrotic syndrome patients. I mean Ayurvedic drugs which are having the above actions. Now, single herbs used in nephrotic syndrome, let us see. Puranava, that is Barhavia diffusa. Varuna, Katavanarvala. Gokshra, Treblis terrestris. Guduchi, Tenospora cordifolia. Saptavarna, Estonia scolaris. Pashana Veda, Erova lanata. Kulatta, Dolichos, biflorus. Kushta, Demostekia, bipin, Kusha. That is Kusha, Desmostakia, bipinnata. And Kasha, Saccharum spontaneum. Ikshu, Saccharum aerorecums. Other drugs, Shara, Saccharum munja rocks. Darba, Desmostakia, bipinnata. Airvaruka, Luminous mellow or altissimus. And Chandana, Santalinum album, this is urinary antiseptic. Sariva, Hemidesmus indica. Dushira, Vetiveria zygenoides. Utpala, Nelumba nisfera. Nilotpala, Nelumba stellata. Kamuda, Nymphia pubescens. And Shatavari, Asparagus racemosus. Now let us see the formulations which are commonly used in the patient of nephrotic syndrome. Mukshradivugulu, Chandraprabhavati, Varunadikwata, Ranapanchamula, Kashaya, Bharatyadi Kashaya, Varunashigru Kashaya, Pranavasva, Sarivadhyasva, Shilajatadiloha, and Chandranavati Loha. And also Shiva Gutika, Shilajatu capsule, Mukshura Bija Churna, Pranavasta Kashaya, Shvetaparpati, Pranavadi Mandura, Kulatta Yosha, Yervaru Swarasa, Ashana Bedadi Churna, Chandanasava, and Amritati Kwata. Now, if you analyze the action of the drugs and formulations which are used in Nephrotic syndrome, following actions are seen. Mutrala, nephroprotective, Rasayana, protein supplement, Medohara, hypocholesteremia, drug that check proteinuria, emetinics, bronchodilators, and cardiotonics. And also expectorant, some complication like cough expectoration occur, then you can or pulmonary edema, you can or infection of the chest, lungs, then you can use expectorants, megalolytics, and Dipana, Pachana, iron supplement, Ojaskara, Jivaniya, Vayastapana, immunosuppressant, Kasahara, Shasahara, Shotahara, and Krishna. So there will be sometimes cough with expectoration because of infection and associated with the nephrotic syndrome. Can give Kasahara and Shasahara drugs. Notice the examples for each action. Mutrala, Ukshirabhijachurna, Pranama, Mandura, and Pranavasa. Nephroprotective drugs, Chandanadilava, Chandraprabhavati, Shivagutika, and Pranama Swarasa. And Rasayana drugs, Guruchi Kashaya and Amrtadi Kashaya. We have protein supplements, Amsarasa, Ajavamsarasayana, Matsya, Chanaka Nirmita Ahara Kalpana, Masha Nirmita Ahara Kalpana. We have this will correct the hypoproteinemia and general sarka. Medohara drugs, Navaka Guru, Amrtadi Guru, and Amla Amlaveta Churna. This will correct the fat, this cholesterol, serum cholesterol. Hypocholestemic drugs, Medohara Gulu, Gulita Kashaya, and Navaka Guru. Drugs that check proteinuria are Amrtadi Kashaya and Guduchi Kashaya. Emetinics, Navaya Saloha and Navaya Churna. Bronchodilators, Somasava, Kanakasava, and Pushkaramalasava. We have cardiotonics, Satpatri Churna, Arjuna Arishta, Nagabala Churna. Suppose heart failure also, left ventricular failure is there, and can use these medicines. Expectorants, Kantakarya Valeha, Talsa Churna, and Vasakarishta. We have mucolytics that break down the mucus, and Vasavaleha, and Talisadi Churna. Deeper drugs, which is Shuntikashaya, Panchakolasava, and Pipali, Shirpaka. Pachana, same drugs. And iron supplements, Navaya Saloha, Dakshadileha, and Pranavadi Mandura. We have to give Ojaskar drugs, which examples are Ashtavra Kashaya, Paneer, that is milk protein, and Gokshira. Jeevaniya drugs like Kshira and Shatavari, Rasayana. Vayastapana drugs, Amalaki Rasayana, Guduchi, Kashaya. Immunosuppressants, Chitrakasva and Chitrakadi Vati. Immunomodulator drugs, Guduchi Kwata and Guduchi Gana Vati. Kasara drugs, Sitapala Churna, Katakarya Valeha and Talisadi Churna. We have Shasara drugs like Talisa Patrataka, Somasava, and Kanakasa. We have Shwetohara, like Pranamadi Mandura, Ukshara and Shetaparpati. We have Kashana drugs like Ruksha Udvarta, that is the treatment, and Mrudu Virechana and Avasega, this is the treatment which cause Kashana disease. Now let us see Patyas in nephrotic syndrome patients. Lagusupacha Hara, high protein diet, fish, meat, etc., and low salt diet. Patyas, salt and water, excessive salt and water intake, fatty food, and low protein containing food materials, and Ushna Tikta Ahar. Coming to discussion. Nephrotic syndrome is a renal disorder in which main pathology is seen in glomeruli due to the damage or degenerative changes in the glomerular basement membrane and glomeruli. There will be increased permeability for protein on which results in hyperproteinemia. Due to daily loss of protein through urine, patients develop hypoproteinemia and subsequent general sarca, that is whole body swelling. These patients are also having hypercholesteremia and lipiduria. Ayurvedic medicines are Mutrala and hypocholestemic, hence increase sodium and water excretion and decreases the lipid in the blood. Emetinics increase hemoglobin percentage in these patients. Nephroprotective drugs that check protein leakage through urine help in reducing nephroprotective drugs and drugs that check protein leakage through urine help in reducing signs and symptoms in these patients. Immunosuppressants and immunomodulators check further damage to glomerular vessel membrane. Ojaskara, Jivania, and Rasayana drugs increase vitality and nourishment. Kasahara, Shwasahara, expectorants, mucolytics, and cardiotonic drugs are useful in patients having complications like left ventricular failure, pulmonary edema, and pulmonary edema due to volume overload. Hence, Ayurveda management in nephrotic syndrome patients has better outcome in these patients. However, you may have to switch on to integrative medicine sometimes when the disease becomes severe. So, coming to conclusion, nephrotic syndrome patients are usually difficult to treat as they have damage to glomeruli or on of nephrons, which is usually irreversible. Most of the nephrotic syndrome patients end up in chronic kidney disease, RPGN, MPGN later, IgN approval later, further CKD. Ayurveda and integrated medicine has better outcome in nephrotic syndrome patients. We can improve the general condition and quality of life in these patients. These are the references. So today we have discussed the Ayurveda management of nephrotic syndrome patients. Thank you for patient hearing.